Tēnā koutou, tēnā koutou, tēnā koutou katoa. Welcome everybody and thank you for coming this evening. It's really lovely to see so many people here and thank you Minister for joining us and allowing us to come to this space. I have a few, my name's Simeon. I've just got a few housekeeping things to do and then I'll introduce you to Sui, who is the chair of our Head and Neck Cancer Foundation. So in the event of a fire, the alarms will sound and please evacuate the venue and use the same route that you came in. In a medical emergency, do not resist the urge to call 111. There's plenty of doctors in the room, but their security team will actually look after you. If there's an earthquake, you should know the drill if you live in Wellington, but otherwise it's drop, cover and hold. And once the building starts shaking, you'll be carefully evacuated. You should have your visitor sticker. The wharepaku are out the doors and downstairs or out that exit to my right. And no, you cannot smoke in this building. And also, if you have a phone, please put it on silent. I have the great pleasure of introducing Dr. Sui Tan. Sui Tan and I go back a long way, so I'll say nice things about him. He's a plastic surgeon at Hutt Hospital. He specialises in head and neck cancer surgery. He is the founder and chair of the Gillies McIndoe Research Institute. Amazing. And the Head and Neck Cancer Foundation of Aotearoa. An internationally recognised researcher in vascular birthmarks and cancer, he's published over 250 articles in peer-reviewed journals. Dr. Tan has received numerous honours, including the Officer of the New Zealand Order of Merit in 2011 for services to medicine. He's amazing and I have loved him forever and I welcome him to the stage.
Thank you, Sam. The Tēnā koutou katoa, the Honourable Minister Simeon Brown, Tony Davis and Maureen Tarney from the Head and Neck Cancer Support Aotearoa, Dr. Hayley Dennison and Olivia Hall from the Sexually Transmitted Infections Educational Foundation, Nick Combe from the Cancer Society, members of Te Whatu Ora and the Cancer Control Agency, and distinguished guests. Thank you all for being here for this occasion. Head and neck cancer is the sixth most common cancer globally. Besides being a threat to life, it profoundly affects the quality of life of the affected individuals. On this World Head and Neck Cancer Day, we remember the patients and their families across Aotearoa New Zealand who are confronted with head and neck cancer. The Head and Neck Cancer Foundation Aotearoa collaborates with key organizations to lessen the impact of head and neck cancer by prevention, early detection, and more effective treatment through research, education, and advocacy. We have identified HPV-related cancer prevention as a critical mission and the focus of this event. Kai moa, kai muri. I walk backwards into the future, learning from the past. With our partners, the Head and Neck Cancer Support Aotearoa and staff, we present you the Aotearoa HPV-related cancer prevention roadmap to achieve 90% HPV vaccination rate by 2030. It is now my pleasure to introduce Minister Brown. We are very grateful for you for hosting this launch at the seat of government. I will be very grateful to hear your thoughts, Minister.
Well, kia ora and good evening, everyone. It's wonderful to see you all here tonight. And it is a pleasure to welcome you all to Parliament to mark World Head and Neck Cancer Day. And to start, I'd like to thank Dr. Samantha Merton for her welcome, Head and Neck Cancer Foundation of Aotearoa, Head and Neck Cancer Support Aotearoa, the Sexually Transmitted Infections Education Foundation, and the clinicians, researchers, advocates, patients, whānau, and everyone who has contributed to this important piece of work that is being launched tonight, which is the Head and Neck Cancer Foundation of Aotearoa's HPV-related cancer prevention roadmap. I'd like to particularly acknowledge the eminent Dr. Sui Tan. Your reputation precedes you, and thank you for the huge contribution you have made and continue to make in your field. Thank you for your commitment to improving cancer prevention and outcomes for New Zealanders. This is a group of cancers that receive less attention than some others, yet have a profound impact on those affected. The most recent data shows that in 2023, 786 New Zealanders were diagnosed with head and neck cancers, and 255 people lost their lives. Head and neck cancers can change the way people speak, eat, taste, swallow, breathe, and communicate. They affect not only patients, but also their families and communities. It is important to note that a substantial proportion of these cancers are preventable. Around 70% of cancers of the mouth and throat are now linked to HPV infection. And as you all know, HPV is also responsible for almost all cervical cancers and contributes to several other cancers affecting both men and women. That means prevention has an enormous role to play. The funded HPV vaccine is one of the most effective cancer prevention tools available. It protects against 9 strains of the virus responsible for many HPV-related cancers and has been shown internationally to dramatically reduce future cancer risk. The challenge, though, is ensuring more New Zealanders receive it. While our HPV vaccination program has made significant progress, current coverage remains below where we need it to be. Improving coverage is critical in reducing the future burden of cancer across New Zealand. The government recognises the importance of this work, and earlier this month we released the New Zealand Cancer Action Plan 2026 to 2029, which outlines our commitment to improving prevention, diagnosis, treatment, and survival. Included in that plan is a commitment to the development of a cervical cancer elimination plan to be released later this year. Alongside that, with screening and treatment, HPV vaccination is one of the key pillars of cervical cancer elimination, and of course is also key to many of the cancers for head and neck cancers as well. Increasing New Zealand's HPV immunisation coverage is a key focus of that draft plan, and I know some of you in this room have been closely involved in shaping that plan or in part of the consultation that Health New Zealand and the Ministry have undertaken and Cancer Control Agency. In addition, Health New Zealand is already strengthening delivery through the school-based immunisation program by focusing on the first HPV dose, that dose that provides the greatest protective benefit. The second dose remains freely available through general practice, pharmacies, and community providers. At the same time, targeted work is underway to reach the hundreds of thousands of young New Zealanders aged 14 to 26 who have missed vaccination altogether. The roadmap brings together expertise from across the sector and sets out a clear vision for improving vaccination coverage, strengthening delivery, engaging communities, and reducing inequities. I wish to welcome the collaborative approach that has been taken in developing the roadmap. The government cannot achieve better health outcomes alone, and success requires partnership between government agencies, clinicians, community providers, schools, iwi, Māori and Pacific organisations, researchers, charities and families. Each has an important role to play because public confidence matters, and ensuring that we have a wide variety of stakeholders involved helps to support that public confidence. It's also about giving the next generation the opportunity to avoid illness that have caused immense suffering for thousands of New Zealanders. So as we continue to develop the cervical cancer elimination plan, the government continues to remain committed to working alongside the sector to improve vaccination coverage, to strengthen prevention, and to also learn from the roadmap that is being launched tonight. In this way, we can continue to invest, continue to support better outcomes for New Zealanders, and continue to ensure we leave better outcomes for the next generation. Thank you very much.
Thank you, Minister. Thank you for your kind comments and your support to improve the health of the people in Aotearoa. Now we are coming to the formal part of the launch of the roadmap, and we are very grateful to have a number of speakers that represent consumer health and research and also advocacy. HPV infection is the leading cause for throat, cervical, and other cancers. These HPV-related cancers affect both males and females. We commend the Cancer Society's recent launch of the cervical cancer elimination campaign. This is a very important part of the work. There has been a rising incidence of head and neck HPV-related throat cancer. Aotearoa has implemented 3 parallel strategies to deal with this problem: treatment of these cancers and pre-cancers. And it is important to note that half of the treatment costs go to treating throat cancers and half to males. We have the cervical screening program. We have the HPV vaccination program, which was introduced in 2008 for females, and then 2017 for males also. And it is free for those aged 9 to 26. It has been shown that HPV vaccines are safe and effective. It is a cancer prevention vaccine. A simple injection could prevent our young people from developing the devastating disease that require complex treatment. But for this to work, it requires high coverage, but Aotearoa is not on track for high and equitable coverage. We have a low and declining vaccination rate, and 320,000 young people have missed out vaccination altogether. The failure to achieve high HPV vaccination rate is a missed opportunity in cancer prevention. It is caused by structural gaps due to fragmented vaccination delivery, inconsistent follow-up of missed doses, and the lack of coordinated national approach. We know prevention through vaccination works, but we are not delivering it. Aotearoa needs to adopt a 90% vaccination rate by 2030 in line with other countries and recommended by WHO. We seek ministerial and cross-party support to progress a coordinated government-led approach. I would like to now invite Doug Russell to the podium. Doug is a business leader in Palmerston North with extensive experience in commercial property sector. He has kindly agreed to share his personal experience as a throat cancer survivor to the conversation of cancer prevention, treatment, and survivorship. We look forward to hearing his perspective on the human impact of HPV-related cancers and the importance of ensuring cancer and family remain the center of efforts to improve cancer outcomes in Aotearoa. Doug, we welcome you to the podium.
Good evening, everyone. I'd like to share a personal story about HPV throat cancer. It's a diagnosis that completely turned my life upside down. It changed the way I think about prevention, about healthcare, and the importance of vaccination. A few years ago, I was diagnosed with HPV throat cancer, and like most people, I never imagined it would happen to me. When you hear the word cancer, your world changes instantly, your priorities shift, your plans are put on hold, you start thinking about things that you've never had to think about before. Living in Palmerston North, my initial diagnosis and treatment came through the public health system, and unfortunately, the outlook I was given was not encouraging. Because of the location of the tumour, I was told that I would need surgery, which would involve splitting my jaw to access it, Even then, there was concern that the surgeons would not be able to achieve clear margins, and as a result, I was advised to prepare for an extensive chemotherapy and radiation treatment following surgery. The message was clear. I was facing a lengthy journey, and I was told to expect an 18-month struggle involving major surgery, intensive treatment, and a very long recovery process. Thankfully, I had private and health insurance, which allowed me to seek a second opinion. That decision changed everything. I was referred to John Chaplin and his team, who had access to the Da Vinci robotic surgical system, and instead of a highly invasive operation, the robotic approach offered a far less traumatic procedure. The tumour could be removed without splitting my jaw, and remarkably, my treatment did not require either chemotherapy or radiation. The difference in outcomes was extraordinary. Rather than facing an 18-month battle, I was back at work within 8 weeks. And although I'm fairly sure John reminded me at the time, I actually needed to be away for 10. For me, the contrast between these two treatment pathways was life-changing, and it highlighted the importance of access to technology, expertise, and options when facing a serious illness. But there's another reason I want to tell this story. HPV throat cancer can happen to anyone. It does not discriminate. It affects men, it affects women, it affects young and old from all walks of life. Most of us never expect it to happen to us or someone we love. And what concerns me the most is that HPV-related cancers are in many cases entirely preventable. We have access to a safe and effective vaccination program that can significantly reduce the risk of HPV-related diseases, including certain throat cancers, and yet the vaccination rates in this country still are not where they should be. Many New Zealanders do not have private medical insurance, and their option, should they develop this disease, is treatment through the public health system, and that treatment can involve complex surgery, chemotherapy, radiation therapy, prolonged recovery periods, and a significant cost to both the individual and the taxpayer. When we consider the human cost, the emotional impact on families, the financial burden on the healthcare system, prevention makes far more sense than treatment. So I would like to finish with a question that I've asked many friends and acquaintances when they have asked me for my thoughts on vaccinating their children against HPV. The question is, imagine that years from now, your son or your daughter develops HPV throat cancer, and imagine they ask you this simple question: why didn't you vaccinate me when you had the opportunity? How would you answer that question? For me, having lived through the diagnosis, the uncertainty, the fear that comes with cancer, that is a question I would never want to have to answer, nor would I imagine anyone from the Ministry of Health want to answer that question. I'm sharing my experience, and I hope in sharing my experience, I hope this encourages this forum to make an informed decision about HPV vaccination, and then telling my story has been worthwhile. Thank you. Look, I'd like to welcome to the stage Dr. Andrew McCann. Dr. McCann is a radiation oncologist at Auckland City Hospital, specialising in head and neck cancer and lymphoma. He is actively involved in clinical trials across Australasia through the Trans-Tasman Radiology Oncology Group, in which he has held a senior leadership role and has co-chaired the head and neck cancer interest groups. He was the trial chair for the radio-HUM study focused on reducing treatment side effects, reflecting his commitment to improving both survival and quality of life for his patients. Dr. McCann is also a trustee of the Head and Neck Cancer Foundation Aotearoa. Please join with me in welcoming Dr. McCann to speak.
Thanks very much. Kia ora koutou. Good evening. So I've just got this one slide to tell a little bit of the story about the treatment for these HPV-related tumours. So the smaller tumours, as we've just heard, are often treated with surgery. And sometimes when we then review the results of that operation, patients require radiotherapy subsequently. And then with the larger tumours, generally we treat those primarily with radiotherapy, often with chemotherapy given at the same time. And this image on the right is showing the radiation dose cloud for a typical treatment for a throat-based cancer. And it's covering where the tumour started in the tonsil area, and these tumours often spread to the lymph glands in the neck. So that red area is highlighting the area which receives the high radiation dose, and the yellow areas are highlighting the areas where there's no obvious cancer, but there's a risk there could be some microscopic cancer. So this type of treatment, we give a small dose daily over about a 7-week period, and it's a really demanding experience for the patient. So they develop throat ulceration, dryness, taste changes. So a lot of our time during the treatment is just managing issues such as pain, helping with their nutrition, etc. And normally it takes probably a good couple of months after the radiotherapy is finished before these symptoms settle to the level where they can try and start having some normality in their lives. But many patients also experience significant long-term morbidity from the treatment, and this can be even years after treatment. So this can be things like swallowing difficulties, which can be minor, but occasionally for patients it can be quite significant swallowing problems. Fatigue can be a big thing, and this can lead to issues with returning to previous employment or having to change employment, and associated things like financial stress, etc. So most patients with these presentations, we do control their tumours, but there's no doubt that this kind of treatment is absolutely life-changing, as we've heard, with the burden of the effects of treatment, the adaptation that people need to undertake to try and introduce some normality back into their lives. And it's just really reinforcing the message that these cancers are entirely preventable if we have an effective vaccination strategy. So it's something that we need to work towards. So not only is this sort of cancer a burden for the patient and their whānau, but if there are these issues with financial stress and employment disruption, that obviously impacts on their ability to participate in their community, and there are all the costs associated with that. And although most patients, this type of treatment does control their tumours, some tumours do recur and spread. And when they do spread, there's no longer a curative option. Patients often are treated with immunotherapy, which has been funded in New Zealand since 2024, but it's a very expensive treatment. So the cost, both for the patient and their whānau, as well as the cost for society, all of these health-related costs just make the rationale to really try and maximise our vaccination strategy so important. So I'd like to now invite my colleague, Dr. Samantha Burton, who's a Wellington-based general practitioner, medical educator. She's a past president of the Royal New Zealand Society of General Practitioners and is the current chair of the Council of Medical Colleges. Dr. Merton was appointed a member of the New Zealand Order of Merit in 2021 for services to medical education. She's recently been appointed as the Deputy Dean of the New Zealand Graduate School of Medicine at the University of Waikato. So welcome, Dr. Merton.
Thanks, Andrew. My hat tonight is a GP hat. I'd just like to talk a little bit about the context that I see in my practice. And I see mums, but mums usually come in with babies and they have, often they will have kids, and we don't probably see the teenagers when they come in. We might see the mum, but we don't see the teenagers. So having that conversation around have you vaccinated your child is not a common thing that I would do, because the child may not be in front of me. So therefore having a vaccination program that works in a school is really good. But that means the schools have to actually make sure that they are doing the vaccinations that they need to do. I think the other thing is that vaccination is not only available in general practice, but is available in pharmacies and elsewhere as well. And we need to make sure that those distributed vaccination programs are really well, I suppose, championed and looked after, that we can travel around and do vaccinations as well. But I think it is having it broadly spread so that it's really easy for someone to get a vaccine. If their kid can get it at school, that's amazing. Having to come and see me is sometimes a bit of a burden. Having to go to a pharmacy can be tricky. If we have a mobile service, that can be better. So the way we vaccinate needs to be a broadly distributed program. I think the other thing is that we need to have the conversation really common. I think when HPV vaccination came out, it was about, sexually transmitted diseases, and that may be part of the story. But as you can see, this affects boys, it affects people who have head and neck cancer as well. It's all sorts of people, and it's not just a sexually transmitted disease that we're talking about. So this vaccine is about cancer. We need to make sure that we are talking about cancer, that conversation is held by everyone. So everyone in this room needs to go and say, over the next week, I went to the Head and Neck Cancer Foundation World Day and talked about a cancer vaccine. Have you had the cancer vaccine? Because this affects everybody. It's not, I remember as a kid having a friend of my parents who had throat cancer. I have patients who come and see me and I have to tell them that they've got cancer. That is the worst conversation that we have to have. And you can hear from stories today about actually receiving that news and how hard and awful that is. And it's not just a sort of like, take this antibiotic and you're fine. This is a journey that these patients have to go on. I think New Zealand is small. When you look at the 320,000 that have missed out already, just think about the fact that we managed to vaccinate 10 million vaccines through COVID. That was 10 million doses got delivered. 320,000 is a drop in the bucket compared to that. So there is a way of doing this, and somehow we need to work towards it. New Zealand is small, we have an excellent health system, and this condition affects everybody. So if we can make HPV vaccine a normal, expected part of everyday care, that's really important, and that means that we all need to be talking about it. So go and find those 10 people that you need to tell about tonight, and then make sure that every friend and family has had their kids vaccinated. I'll leave it at that because there's a lot more people to speak, and I'd like to introduce Dr. Hayley Dennison. Hayley is a research fellow at Massey University Centre for Public Health Research and an epidemiologist specialising in sexual and reproductive health. Her work focuses on STI prevention, health behaviours, and improving equitable access to evidence-based care. She contributed to the health economy study on the cost of HPV-related cancers in Aotearoa, New Zealand, commissioned by the Head and Neck Cancer Foundation of Aotearoa, helping quantify their significant impact and strengthen the case for prevention strategies. Her research supports policy, advocacy, and system-level change. This is everyone's job. The government wants us to do it and is supportive, but we need to be all doing it. So thank you, Hayley.
Tēnā koutou katoa. I'm Dr. Hayley Dennison, and I'm one of the researchers who worked with Dr. Simeon and the wider clinical research team on the health economy study on the cost of HPV-related cancers in 2024. And this is the evidence-based report that underpins the roadmap launched this evening. I'm also the chair of the Sexually Transmitted Infection Education Foundation, or STIFE, which is one of the partner organisations for tonight's event. So it's a privilege to be here tonight as part of this important moment, launching a national roadmap that can fundamentally change the future of cancer prevention in Aotearoa. My role this evening is to speak to the scientific evidence, what we know about HPV-related cancers, what it's costing us, and what is possible if we act now with a concerted HPV vaccination strategy. In Aotearoa, we are seeing around 600 new HPV-related cancer cases every year. These include cancers of the throat, cervix, and other sites. And the burden is growing, as we've heard. Rates of HPV-related oropharyngeal cancer in particular have been steadily increasing over time. But alongside the human impact is also a very real economic cost. Our recent analysis shows that over just a 4-year period, HPV-related cancers cost the New Zealand health system more than $140 million. That includes over $90 million in treatment costs and nearly $50 million in detecting and managing precancerous disease. And importantly, this is actually an underestimate. So it does not capture private treatment costs, loss of productivity costs, or the wider social and economic impacts on individuals, whānau, and communities. So we are spending significant resources treating disease that we have the tools to prevent. And the evidence is unequivocal. HPV vaccination is highly effective, safe, and cost-effective. High vaccination coverage doesn't just protect individuals, it creates population-level protection, what we know as herd immunity. It reduces transmission, lowers cancer incidence, and over time can fundamentally shift the burden of disease. We have seen this internationally. Countries with high vaccination uptake, such as our Australian friends, are already on track to eliminate cervical cancer and significantly reduce other HPV-related cancers. And yet here in Aotearoa, we are falling behind. Our vaccination rates remain well below the global target of 90%, with recent data showing coverage around 60 to 70%, with coverage being lowest for Māori and Pacific rangatahi. This is not a failure of science, this is a failure of delivery. We have a prevention tool that works, but we are not reaching enough people, we are not reaching them early enough, and we are not reaching them equitably. And that is why this roadmap matters. It sets out a clear, evidence-based pathway to achieve 90% HPV vaccination coverage by 2030, not as an aspiration, but as an expectation. Because reaching that level of coverage would prevent thousands of future cancer cases, reduce long-term pressure on our health system, and importantly, help close persistent equity gaps in cancer outcomes. And from an economic perspective, this is one of the most compelling public health investments we can make. We are currently funding the consequences of preventable disease. The opportunity is in front of us to invest in prevention instead. And the return on that investment is measured not just in dollars, but in lives saved. So the message from the evidence is clear. We know the scale of the problem, we know the cost, and critically, we know what works. The question is no longer whether we can prevent these cancers, it is whether we will choose to. Ngā mihi nui. Right, I'm now going to invite Dr. Dean Rusk to the podium. So Dr. Rusk is a New Zealand-trained otologist, head and neck surgeon. He graduated from the University of Otago Medical School in 1991 and completely advanced surgical training in ORL in 2000. Postgraduate fellowship was in head and neck cancer surgery at the Royal Adelaide Hospital in South Australia.
Thank you. This is quite a surprise to me. I wasn't due to talk tonight, but I suddenly thought, as my colleague didn't arrive, I wondered what I was going to say. And I think back 20 years to when I was a registrar and HPV was never discussed and not really an issue. And over the 25 years that I've been doing head and neck cancer role, there has been about a 5% increase per year in HPV incidence with head and neck cancer, which is quite significant. As we've heard already, there's about half of the burden of the economic impact in New Zealand for HPV is head and neck related. And so my job as head and neck cancer surgeon is, again, to have that difficult talk with patients about cancer, but also to inform people of the role of surgery in that cancer. Now, this has been touched on by Doug tonight, and Doug's fairly well described a couple of the issues and a couple of the avenues that people go down with head and neck cancer from a surgical point of view. So, from an impact point of view, you can understand if TORS, which is the transoral robotic surgery, has revolutionised access into the oral cavity. It enables us to be quite meticulous with surgery in the oral cavity and in and around the tonsil area, and minimising the devastation of the access that he also described. So for larger surgery in the oral cavity, it involves splitting lips, splitting jaw, opening everything up to access the tonsil. You can imagine the devastation to people's swallow, to people's articulation, and to their aesthetics involved. We would also address the neck disease, local and regional disease in the neck, and that also has issues with complication risk from a neural point of view, as well as swallowing and speaking point of view. So you can see that from a surgical point of view, this is typically not an avenue that people go down unless their tumour is either very small or large and people have failed chemoradiation therapy down the track, and usually we're talking about pretty big surgery in this case, which has a lot of impact. The long-term morbidity and survivorship of this is mixed. People are frustrated with both the surgical access and the ability to eat, the ability to have dentures or have dental restoration, the ability to have ongoing speech and language therapy involvement, and the ability to have dietitians and cancer psychology involved with the aesthetic side of things, and how do I get back to my job, how do I get back to the community. So you can see the surgical burden of head and neck cancer and HPV disease is significant. Prevention is a no-brainer. It's far easier to prevent this disease than either have chemoradiation therapy, which is already talked about, or highly invasive surgery for this disease. As clinicians, we continuously see the devastating impacts of these cancers, and how can we work together to prevent New Zealanders from facing the tragic reality of this disease. Thank you.
I'd like to thank all the speakers for the wisdom. The pathway forward is clear. We need to achieve the Roadmap 6 priorities. We need to commit to making HPV vaccination a national priority. We need to establish a national leadership and task force. We need to target and reach the missed cohorts. We need to strengthen systems and school programs. We need to shift the public understanding and the conversation. HPV vaccine is a cancer prevention vaccine. We need to embed equity in all delivery. We must have genuine partnership with Maori, Pacific, and underprivileged communities. Hikura te tangata, our humanity is precious. I would like now to invite Maureen Tarney, who is a trustee and patient advocate of Head and Neck Cancer Support Aotearoa. She brings a powerful life experience perspective to the conversation on cancer prevention, treatment, and survivorship. She's also a member of Aotearoa Tangata, the consumer advisory group of the Cancer Control Agency. Maureen, I invite you to give your speech.
Tēnā koe sui. Tēnā te whare. Tēnā te whare o Paremata. He mihi ki a koe. Ki te minata, kua wehe ia ahakoa, he mihi anō ki a ia. Ki te honga manatu hauora, whatu ora, ki ngā tangata katoa, ngā rau rangatira mā, tēnei te mihi, tēnei te mihi, tēnei te mihi ki a koutou. Aira, kia ora. He mihi nui ki a koutou, nā tētahi mokopuna nā tainui waka. Maua. Ko Ngāti Maniapoto te iwi, ko Ngāti Ua Kaha te hapu, ko Maureen tāne ahau, mauri ora ki a koutou. I am a trustee with Head and Neck Cancer Support Aotearoa. We support patients, their caregivers and their whānau on their journey to survivorship. We have an online community of almost 1,000 patients. So when I stand here with hundreds of others who have also battled this disease. Kei tēnā ki wā o Matariki, at this time we honour those who are no longer with us and the many who are currently managing their way through a very tough treatment plan, as my friend here has talked about, and dealing with very brutal outcomes. Ai he mōrehua hau, I am a survivor and I'm here to talk about what it is like to be a survivor of a head and neck cancer. The treatment journey started with removing my teeth, being fitted with a radiation mask and inserting a feeding tube so that I could survive without eating, without swallowing. And then the rounds of radiation and chemotherapy, very tough side effects, multiple admissions to ED, pain, morphine addiction. And here's the thing, this suffering is unnecessary and it's preventable. And the prevention is a vaccine that's been available here in Aotearoa for more than a decade. Head and neck cancers have profound and lasting impacts on our physical health, but also on the things that make us feel fundamentally human and connected. The ability to kōrero, to communicate, to enjoy kai, to work, to be creative, to feel like part of a functioning hapori, community, and really just to simply feel like yourself. Many of us lose the ability to speak clearly. I'm quite lucky, I can make myself understood if I speak slowly and I drink water, thank you. But some lose the ability to speak at all. Eating and swallowing can become so difficult that we rely on feeding tubes and kai, food which is so central to enjoying life, to gathering together, to enjoying whānau time, becomes a medical procedure or a sideshow to the main table. Tuakiritanga, that's our identity, our quality of life, how the world and our people see us and know us. The social cost of this disease feels enormous when you struggle to communicate and you look and you sound different to the person you were before this disease. And then there's the mental load, the fear and the stress, to 2 a.m. Googling. I do not recommend you do that at all. Financial hardship through surgery, recovery, survivorship, when that worry just lives permanently on your shoulders. Head and neck cancer, it takes lives, but it is also survivable, clearly. But it will leave you profoundly changed. And it's easy to listen to statistics and data, as we've heard tonight from these amazing folks. But it's harder to remember that each number, each statistic is somebody's papa, someone's loved one, or it's me, or it's Doug, or, oh, my apologies, or your friend, or our friends. Recently, we polled our head and neck cancer community, our wonderful, hearty online community of nearly 1,000 people. We asked them, what are the current priorities for you on your cancer journey right now? And as expected, we heard about dental woes, about financial hardship, ongoing pain management, the need for counselling, nutrition, rehabilitation advice. But the top priority for our people, given all of those things that are going on in our lives, but the top priority for them was awareness and prevention of this disease. As you've heard, HPV-related head and neck cancer is now the most common HPV-associated cancer in many countries, and it's almost entirely preventable. We must vaccinate as many of our precious rangatahi as possible. It is safe, it's effective, it's accessible, it's free. Mō ngā mokopuna ka heke mai. Through awareness and vaccination and our collective action, we can prevent what is quite simply unnecessary suffering and protect our precious future generations. Nō reira, he mihi anō ki a koutou katoa. I'm going to hand back to my new but lovely friend, Dr. Sweetan. Yes, you, yes.
Thank you, Maureen, for sharing your experience and for your advocacy. So what does success look like? Success will mean 90% vaccinated, cancer prevented, and inequities reduced. This is achievable and is necessary. There is no acceptable alternative for us. So what does success mean? It would stop us being the ambulance at the bottom of the cliff. Dean, Andrew, and I would just stop working. We go and play golf. That is success. It would negate the need for intensive and obtrusive treatment that are associated with escalating cost, human suffering, personal economic cost. It is all unnecessary. It would mean winding down existing programs like cervical cancer screening program. And why wouldn't we do that? Our immediate priorities are: we need a public endorsement of the 90% HPV vaccination target by 2030. We need government commitment and necessary funding to achieve that. But wait a minute, we are already partway there. We started this whole thing in 2008. We just need to accelerate it and make it happen. We need to establish a national cross-section task force within 3 months. The matter is urgent. And to finish off, I'll leave you with this thought. Nā ho aura mai tina koto katoa. And we would like to invite you to stay back for a coffee. And thank you all for being here. Sue, I think you have a copy of this, Sue? Yeah, so please take a copy before you go. Thank you very much for being here. And I believe that all of you and all of us have a role to play to make this happen for Aotearoa. Thank you very much.